Hello, everyone, and welcome to today's JCG podcast. I'm Dr. Gengqing Song, social media editor for the Journal of Clinical Gastroenterology, JCG. We have a very exciting session today, focusing on a topic increasingly relevant to our field, microplastic, nanoplastic, and their implications for gastrointestinal health. Joining us today are two distinguished guests. First, our editor-in-chief of JCG, Dr. Ronnie Fass, a world-renowned expert in esophageal and gastrointestinal motility disorders, professor of medicine, chairman of the departments of gastroenterology and hepatology at Metro Health Medical Center, Case Western Reserve University. We also have Dr. Eli Ehrenpreis, the corresponding author of today's featured paper, joining us from Advocate Lutheran General Hospital in Park Ridge, Illinois. Welcome, both of you. With that, I will hand over the conversation to Dr. Fass to lead our discussion.
Thank you very much, Dr. Song. This is really a great opportunity to discuss a fascinating paper that was published in the February issue of JCG. And obviously, the title of the paper raises a lot of questions, how this paper ended up in a GI journal. And we have the senior author of the paper, and I think it's an opportunity to ask him a few questions about the impetus behind writing the papers, and if he can tell us also what are the key findings.
Absolutely, and thank you, Dr. Song. Thank you, Dr. Fass, for the invitation today. I really appreciate it, and I appreciate the Journal of Clinical Gastroenterology inviting me today. As Dr. Fass and I go way back, I don't know if he recalls, but besides training in gastroenterology, I also did a fellowship in clinical pharmacology, which is a focus of my interest. And this brings us to this topic, which is microplastic and nanoplastics, which today on the clinical side, we don't know that much. We just know there's a huge problem here, and the gastrointestinal tract is the epicenter of where all comes together with the effects of plastic pollution. So as far as my interest, I think from a pharmacology, toxicology point of view, I think this is extraordinarily important. From the interest of a practicing gastroenterologist or an academic gastroenterologist, I think there are 2 points we need to know. One, as people living on the planet Earth, we have to understand that this is a huge environmental problem and that it's growing worse. It's not getting better. And now we're discovering that there are significant health consequences because we are exposed to the breakdown products of plastics. So because the most common site of intake of plastics is the gastrointestinal tract, and there have been studies looking at the details of that and what it does to the GI tract, that sort of leads us to what we will know in the future about this. So for me, this is a great time to get everybody on board understanding this, because we will hear more about it and we will understand the consequences of what we've unfortunately done with plastics in our environment.
Yeah, I'm very intrigued about it because we know that we have issues about disposing plastics and its ability and the ability of plastic to degrade over time. And so that,
Yes.
which brings us obviously to GI. If you can give us more information about the relevance
Yeah, well,
from
first
a
of all,
clinical point of view?
sure. As I segue into that, we have to remember the healthcare system dumps about 14,000 tons of waste daily, and 25% of that is plastic. And the major sources from the healthcare system are the ICU, the endoscopy suite, and the cath lab. So unfortunately, right now, 90% of these plastics are not recycled. In terms of gastroenterology, we start with how this is being studied. Now, we don't have a lot of clinical data, and I'm hoping I'll describe a little bit of that later because there only is a little bit. But first of all, how is this being studied? What kind of effects are we seeing in the GI tract? We're using animal models for this, and if you think about the animal models we use, you'll understand why we use those models. So we use fish for starters, and fish like zebrafish and guppies can be continuously exposed to plastics in their environment. So we also use earthworms because they chew up the soil, or they don't chew it, they don't have teeth, but they bring in the soil and they process it continuously. For animal models, we use mice. And generally the plastics are put into their bottled water, so they're intermittently ingesting. Most of the studies are very short term, but guess what? If you look histologically at the GI tract and you take a deeper dive, there are actual effects even after 24 hours. We start to see effects on the gut. For example, in the fish model, there's already villus destruction that starts to occur. We see a decrease in villi. Some of the other models, we see autophages causing this kind of destruction. We see the production of oxygen radicals, and we see disruption of the gut barrier. So when that happens, there's a likelihood of toxins and other things that are coming in by paracellular transport when there's destruction of the gut barrier. So these are all effects that we've seen. Another thing I should mention, and this is something gastroenterologists should know because it's very important right now, a lot of times when you hear plastics and plastic breakdown products, there's some terminology that's really, really important. First of all, they're macroplastics. So I don't know if you know, but there are these things called ocean islands, and they're floating around in the ocean. The largest one, the Pacific one, is about the size of the state of Texas, 250,000 square miles of plastic. And it's not just plastic, but this isn't just you're seeing plastic bottles. This is creating a milieu where the plastic is breaking down into smaller and smaller particles, and it's actually a chemical laboratory that's going on over there. And as you could imagine, the wildlife are ingesting this as it gets into smaller and smaller particles, and then subsequently we're exposed, particularly through the GI tract. So first thing from a gastroenterology point of view, terminology, macroplastics, microplastics, which are 5 millimeters to 1 micrometer in diameter. And then what we're learning a lot more about, and this is probably the biggest risk to us, are nanoplastics. Those are less than 1 micrometer, which is 1,000 nanometers, all the way down to 1 nanometer. Obviously, smaller particles like this have a better ability to enter into the GI tract and start to wreak havoc. So so the major way that we acquire plastics into our body is through the GI tract. They're also inhaled. They can also get absorbed through the skin. And we find microplastics in the brain, in the gut, in the liver, even in the placenta. And one thing I should mention, that this is all new information. We've just recently been able to identify clearly nanoplastics. Why is that important? Because For example, if you look at the data, the average bottle of plastic water has about, let's say, 250 microplastic units in it. A recent study using more advanced techniques where you can look at the nanoplastics, tiny little particles, it's more like 250,000 of those particles in one bottle of water in a plastic bottle. So they're going into the GI tract primarily. They're causing damage to the intestine. They're getting absorbed and they're going to the liver. And we're just learning things that they do in the liver as well.
I assume that many people that will listen to what you just said, they wonder at what point they should suspect that nanoplastics are the potential cause for patient's symptoms or the patient's disorder. It's probably something that they will be wondering about.
I think it's a wonderful question. I think we're still far, far away from understanding all the clinical implications and how to apply them to individual patients. The closest that we could say in terms of nanoplastics and their effect on disease is probably inflammatory bowel disease. Why? Because we know in the animal model, they do a lot of things that we see in patients with IBD. So they upregulate inflammation. They increase TNF alpha and some interleukins, perhaps IL-6. They also disrupt the gut barrier, which we know is an important component of IBD, and they affect the gut microbiome. So in animal studies, for example, we see less Bacteroides, less anaerobic activity in the gut. And of course, in terms of IBD, that could cause secondary effects, like, for example, less short-chain fatty acid production, more local inflammation, et cetera. So what to tell your patients? You can't read a book to tell you what to tell your patients, but there are some simple things that you could consider. One simple one would be, especially a patient with IBD, try to avoid plastics. And single-use plastic containers, we should all try very hard to avoid. I did a survey in our own hospital, and for example, in the endoscopy suite, I checked to see how many recycling containers we have. Unfortunately, the number was 0, and this is very, very common. So as a group, we can start emphasizing recycling. For individual patients, I have my own list. I'm happy to share a few things if you'd like to hear.
Sure.
Okay. One thing we don't think about are toothbrushes. Toothbrushes, the brushes are made of plastic. We're abrading them. There's no doubt that we're causing little microplastic chips and even nanoplastics when we brush our teeth. Fortunately, there are other types of natural products that are being used to make toothbrushes. I can't say it's going to prevent disease, but I don't know why we wouldn't start switching over, especially if we're really being conscientious about this. One common recommendation, which is not my personal, but it's known, do not microwave plastic. So if you're warming something up in plastic, do not do that. Put it in a plate. Don't microwave it. Another thing to do, avoid the plastic, the water in the plastic bottles, I think is kind of an easy one. A lot of people carry around these steel containers now. If you have a high quality water filter in your kitchen or wherever you obtain your water, it's known that that will filter out microplastics. Nanoplastics are, again, something maybe you and I will talk about 10 years and we'll understand, 10 years from now, we'll understand it better. But for the time being, using a high quality water filter would be strongly recommended. Try to encourage recycling. And here's one of my personal ones. When you warm up a cup of coffee in a common coffee making machine, you take a plastic, the coffee's sitting in a plastic container with a seal. It breaks the seal and then it pushes extremely hot water through there. In my view, that can't be good. There are no data on it, but I know in my house, I ban those, and there you can purchase stainless steel containers with mesh that have no plastic, that have a metal top. Fill that with your favorite ground coffee, and it fits into those machines, and you can make coffee and not worry about drinking heated plastic, which, again, in my view, I'm a bit passionate about this, which I think we all should be, because we're getting into trouble here with this. And you know, the production is going up exponentially, the pollution is going up exponentially. Where there's a recent study, I'm sorry if I digress, but where they looked, we talked about the ocean, they looked at coastal communities around the US, and they matched the water quality and the amount of microplastics with disability, such as cognitive disability and functional disability. And the communities that had the higher microplastic concentrations in their local ocean water, presumably they're eating the fish and they're drinking the water, they had a higher rate, more than 10% in some cases, of cognitive disability at home. And we do know that microplastics accumulate in the brain. So we all want to keep our brains working well. So it starts in the gut, ends up in the brain, and we want to do our best to try to avoid that.
I mean, before I will ask you to make some, to provide some remarks before we close the session. I'm very intrigued to know, what do you think is going to happen in the future? Are we going to get better with the recycling of plastic, or we're going to get deeper into this problem? Is it going to get worse before it's going to get better?
I think it's going to get worse before it gets better. I think also we're going to, in the near future, we're going to learn a lot more about nanoplastics. And I think that's, from a human health standpoint, there have only been a few studies now looking at nanoplastic concentrations, for example, in cirrhosis of the liver and other conditions, looking at fecal matter from patients with IBD, looking at brain levels. I think when we can measure those, remember, it's not like measuring a chemical. You have to measure a tiny particle. So it requires some advanced techniques. I think we're going to learn a lot more about the pathophysiology of nanoplastics. And hopefully when we know that, as physicians, we'll have better tools, or at least we'll have a better understanding of how we can avoid the toxic effects and perhaps disease-promoting effects of these.
Well, thank you very much for this important information. I mean, personally, I think this is a very important issue and topic. Your paper raises really awareness about the potential harm that plastic can cause to the human body, but specifically to the GI tract, and from there to different GI organs. There's still a lot of work to do here, as you mentioned. We have to learn the specific effects, especially of nanoplastics on the human body, and again, specifically the GI tract. And I think we have to develop some new ways in how we try to avoid consumption of this material, or minimize the consumption of plastics, which you describe very nicely, their toxic effect on the human body. I'll hand it over to Dr. Song to close the session.
Thank you, Dr. Ehrenpreis, for sharing this critical insight. And thank you, Dr. Fass, for guiding today's important discussion. To our listeners, today's conversation highlights why we as gastroenterologists must stay informed about emerging health threats, such as microplastics and nanoplastics. Please check out the full article in the February 2025 issues of JCG for more details. Thank you for joining us, and we look forward to welcoming you again on the next episodes of the JCG podcast. Stay informed, stay proactive. Until next time, take care.
Thank you very much.